You are listening to the NASP podcast. The Specialty Pharmacy Podcast is a collaboration with the National Association of Specialty Pharmacy, the NASP, and the Pharmacy Podcast Network. The mission of the National Association of Specialty Pharmacy is to improve specialty pharmacy practice by promoting continuing professional education and certification of specialty pharmacists while advocating for public policies that ensure patient access to specialty medications. As the healthcare industry's leading podcast dedicated to the pharmacy profession, the Pharmacy Podcast Network is proud to bring our listeners the NASP podcast in partnership with the National Association of Specialty Pharmacy.
Pharmacy Podcast Network, welcome to the NASP Specialty Pharmacy Podcast. I have been so proud to be part of this publication, very special to the specialty pharmacy industry, in partnering with the National Association of Specialty Pharmacies. And once again, our host comes back to the show. As busy as you are, Sheila, we know how fast you're running and everything that you're doing for not only the NASP, but specialty pharmacy overall. How you doing, Sheila? What's been going on?
Well, thank you so much, Todd, and thank you so much for your partnership. We're so happy and excited to be part of the Pharmacy Podcast Network family. Things are very, very busy, and we're very active. We're working and advocating in Washington, D.C. on behalf of specialty pharmacy and the patients that we serve. We're also very actively preparing for our annual meeting in September. I personally feel that this meeting is shaping up to be our very best ever, so we're very excited, and we look forward to seeing all of our listeners in Washington as we gather together to learn more about specialty pharmacy practice, what's happening in Washington, new emerging technologies and therapies, and we have the opportunity to network and to share some fun together. So lots going on at NASP.
Sheila, this is an exciting episode. We're going to be talking about something that's very important to shaping specialty pharmacy, better standardizations of not only information, but what comes out of practice, what comes out of analytics, what comes out of gathering additional data. And that's a survey that has really been boiling, has been coming up with much better ideas and cultivating ideas of what is a better specialty pharmacy provider. Set the stage for this survey, and then Sheila, introduce our guests on the show today too.
Sure, Tom. So way back in 2016, in July, to be precise, of 2016, NASP partnered with the SullivanLuallin Group. And what our intent here was to develop a patient survey, a patient satisfaction survey that helped to address the unique attributes and quality objectives of specialty pharmacies. So we felt that it was very important to try to standardize this survey type instrument and to ensure that the answers or the responses that we were receiving helped our specialty pharmacy members adjust and tailor their service offerings and their patient care plans to meet the needs of our patients and also of the payers of their services. So as I said, we engaged in a partnership with the SullivanLuallin Group, and those are the folks who are joining us today. And with us, we have Tom Jeffries, and I will let him introduce himself, and then also Anya Rubin.
Well, yeah, this is Tom Jeffrey, president here at SullivanLuallin Group. It's a pleasure to be here today.
And this is Anya Rubin. I head up our sales and marketing for SullivanLuallin Group, and I've been fortunate to partner with many of the specialty pharmacies that we've worked with, and as well as NASP.
Also joining us today, Todd, is Amanda Winter, and she is the committee chair of our Customer Experience Committee. So in addition to developing this partnership with SullivanLuallin Group, we felt that it was important to bring together to form a committee and bring together various stakeholders across our membership to help ensure that the tools that we were building reflected the needs and the sophistication, I guess, of our membership. So Amanda, welcome.
Good morning, everyone. I am excited to have the opportunity that we've been building instruments that will help us improve the satisfaction across all specialty pharmacies and have some standardization within the tool. I have the pleasure of working within U.S. Bioservices as the vice president there, but also working with this committee with my peers to make sure that we are trying to create some standardization within specialty pharmacy.
Excellent. So now move into the questions to Amanda, Sheila.
All right, so let's talk a little bit about the history, Amanda. Why was it important for the specialty pharmacy industry to standardize a survey instrument, in your opinion?
Well, I think this is incredibly important because as a specialty pharmacy, there are contractual requirements that we have to measure satisfaction, whether it's due to contracts that we have with payers and manufacturers, our accrediting partners, and there's no standardization across those different contractual requirements that we have. They all have different measurements that we're held to. And so we, within the specialty pharmacy industry, we've all had different ways of measuring that. We have lacked that third-party independence for the most part. We've all kind of handled that differently. A lot of the specialty pharmacies have measured our satisfaction in-house. Some folks have maybe not even done a true measurement, but just kind of tried to estimate what that looked like. We may have used technologies such as SurveyMonkey, which didn't really handle the complexity within which we needed to do statistical analysis, being able to look at the complexity within our industry. We were trying to, as I mentioned before, look at what the requirements were for perhaps our accrediting bodies, such as URAC, ACHC, Joint Commission, our payers, our manufacturers, and we needed one survey that met all those needs. Otherwise, we were having to do multiple surveys across our patient population, and we weren't able to do benchmarking against our other specialty pharmacy competitors, and so we didn't really have knowledge of how we compared against our and know our competitive advantage against our peers. And we also really struggled to understand what our true customer experience looked like, which obviously was the end goal, that we wanted to understand where we were doing well, obviously, but most importantly, to understand the opportunity that we had to improve the service offering that we have for our patients. We're all here at the end of the day to provide a service to our patients and to make sure that we're meeting their needs and their expectations and creating a value and an outcome for those patients. And so creating this standardized tool allow us to have one unique offering that provided us all of those things that we desired within that one standardized tool.
Sheila, I'm listening to Amanda, and it excites me to hear that the continuance of excellence is taking place. I mean, I hear things about URAC and ACHC and various standardizations, but it's the NASP that has led the way. So how has NASP positioned itself as an industry leader?
Well, Todd, I think being that we are the only trade association that represents all of the stakeholders in the specialty pharmacy industry, and what I mean by that is our members include, in addition to independent specialty pharmacies, we also have integrated health delivery systems. We have pharmaceutical manufacturers. We have PBMs and managed care organizations. We have GPOs and wholesalers. We also have patient advocacy groups and the folks that help to utilize the data and our technology providers. So all of our members somehow, although they may not be pharmacists, they all somehow impact that patient care journey for that specialty pharmacy patient. So NASP is trying to establish itself as the leader in specialty pharmacy, and anything that helps to promote the practice of specialty pharmacy and enhance the value of the services that we offer to these very vulnerable and often, fragile patients is definitely at the forefront of what we're trying to do. So satisfaction being so integrally involved in everything that's talked about with respect to healthcare, right? The triple aim, one of the, the three tenets is satisfaction. Medicare as well, the Part D program, and also, Medicare Part B is all focused on satisfaction with the program and the providers and the type of care and the quality of care that Medicare beneficiaries are receiving. So we definitely want to ensure that our pharmacies are receiving the necessary and the required input from their stakeholders to ensure that expectations are met and the patients and providers are satisfied. So Tom, as we're looking over, back over the last 2 years, what does the partnership with SLG bring to this program?
That's a great question. And listening to some of the conversation that's been going on before this, you can see that there's a lot of things that went into developing the program. And I think that was another unique thing about working with NASP, because of the membership that were on board very quickly, were able to quickly share what they were doing. It was from these various pieces that we were able to take a look at all the different question types. And one of the things that we really strived to do was put it on a unified scale, bring some order to what, a little bit of the chaos that was going on in the process, really with a mindset to ensure that we were developing a tool that met all of the reporting requirements across all of the different specialty pharmacies that were being involved. Even today, we allow individual pharmacies, specialty pharmacies, to put in custom questions at the end of the survey, really with this mindset that this is a dynamic process, that we know things are going to be changing over time. And in conjunction with the Customer Service Experience Committee, we're really helping kind of ensure that we have a continually viable tool. Likewise, we've gone to great lengths to ensure face validity, that we're asking questions in a way that patients can clearly understand, so that when we're getting feedback back from them, we know they're responding to the things that we're asking about. And finally, we wanted to design a tool that was really helpful and meaningful for the participating specialty pharmacies. Beyond being able to speak nationally on what's going on in the industry, it was important for us to have a tool that the individual pharmacies could garner great value from. So we went to great lengths to develop a survey in which there's some key outcomes like our Net Promoter Score and overall satisfaction with the care experience and things of that nature. And then really design questions around each of the touch points the specialty pharmacy has with patients and asks how we're doing. And in designing the survey that way, it really allows us to be able to take a look at which aspects of the care experience are most important for the patients that are being surveyed, and it really becomes something that's very specific to their population. Likewise, I think partnering with an independent organization that is dealing with this independently, I think adds more credibility, and we bring the statisticians and analysis into it to, I think, really develop a strong, robust product.
So Sheila, what are the goals of the survey program overall? How has NASP really positioned itself with those goals, aligning those goals with what you've been doing all along?
Sure. So, one of our key drivers of the mission of NASP is to promote and elevate the practice of specialty pharmacy. So in developing this survey tool, our goal was to ensure that the tool accurately and precisely measures the specific drivers of, when we started, patient engagement and satisfaction. But as we continue to look at ways to expand the offering of this tool and the value, we're now extending into prescribers and pharmaceutical manufacturers as well. But we wanted to make sure that we were looking at the valuable data that exists around cost savings, around the quality of care, around outcomes and prescription access. We're also looking at, the unique individualization, I guess, of clinical services that are offered by specialty pharmacies, and also patient education and ways to reach that patient and engage them in ways to adapt based on patient needs. So we're really hoping too that our specialty pharmacy partners who have, who are using the tool will be able to gain these valuable insights that will help them to benchmark themselves and then help them to improve, right? And to continue to evolve as the industry evolves and as we have new and emerging drug therapies and treatments, to make sure that they're able to deliver and to compete and to provide the best quality care for these patients. So Tom, as we're getting more into this and we're exploring further, tell us about what's included in the program. Let's talk about the sampling, the distribution methods, the response rates, and also what types of data and reports are available.
Certainly. So really, we've designed this in such a way that unlike some other offerings that are out there, we wanted to make sure that each participating specialty pharmacy was represented with statistics, that was easy for me to say, right? Statistically viable data, and that there really was something that was clearly representative of what's going on within that particular specialty pharmacy. And we thought by bringing everybody into the pool with that kind of mindset would ensure that the benchmarking database was truly representative of those participating in the program. And so to that end, what we realized is that at a minimum, we'd like to see at least about 400 patient responses for each participating specialty pharmacy. And we've been able to determine from our experience that about 2,500 patients being surveyed over a period of a year will most likely result at least in 400, if not more responses. And actually, we're seeing about a 15 to 20% response rate in the specialty pharmacy industry now. So we have two key methods with which we're distributing. The mailed, again, is up to 2,500 surveys. Some of the clients are doing a much heavier or larger sampling, and others that don't have that particular volume of patients, we're doing what's called a quasi-census survey, where we're going to be surveying all unique patients that they've worked with over the last 12 months. And in so doing, that brings everybody together again, like I said, with a statistically viable sample. And then the other method that we have is the online or email approach. And there we're basically offering it unlimited to all patients that the specialty pharmacies have email addresses with and distributing the survey and collecting the data. Now, some unique things about that online approach is that we actually are able to track by respondent. We're able to send up follow-up reminders to non-responders. And all of the data is being collected in real time. And even more importantly, we have the ability to institute service recovery. So we can actually prompt patients at the end of the survey as to whether or not they'd like to be contacted about their care experience or maybe any concerns that they might have with the medication that they've been prescribed. If they say yes, a little pop-up window comes up. They're able to fill in their information, what they'd like to talk about. And as soon as they hit submit, a member of the specialty pharmacy team is immediately notified via email. We have a very robust online management system to manage these requests for contact. It's just a great way to kind of have that other opportunity to pick up on the back end. With the mailed survey, the frequency really depends on the participant and what their needs are in terms of what they have to report out to various stakeholders in there. Again, like I explained earlier, we do allow for some customization. There's no additional charge on that. Our goal is really to put together a tool that they can take and really hit the ground running. And then finally, they've got a great set of reports that they're able to access online via our online reporting system that really lays out the data in easy to understand ways. We'll walk through all of the various reports that do things like we have one that will actually take a look at different time frames to see if there's changes in scores and whether those changes are actually statistically significant, which is great for continuous improvement. We've got a great summary analysis, all of those type of things. And we are also right now, as part of the NASP program, tracking responses by disease state. And we find that to be something that's extremely valuable to those participating in the program as well. In addition to that, many of our clients have payer requirements, and we're able to pre-populate that information to make it very easy for them to pull reports by payer as well. And then finally, every participant is given access to the database, so they're given the benchmarking data, and we will also do a very in-depth analysis of their individual data. We'll walk through all of the reports with them. We'll talk about strengths, opportunities for improvement. We'll actually do some linear regression modeling of the data in order to determine which aspects of the care experience are most predictive of their net promoter score, really with the mindset to lay out a roadmap for them to for success moving forward. And so, Amanda, you've worked with us now for a couple years, and is there anything I missed on that?
I think the one thing I would add is the fact that there is customization within the program. So while there is standardization in the survey process, there is the ability to customize and add some additional particular areas within your business that you do want to obtain customized information on around your business. Perhaps you might want to understand if you provide nursing, how your patients are responding to the nursing services that you provide, or whatever it is that you might want to track. And then you can have customized reports provided back to you on that particular segment of your business that you are looking to manage within the surveys.
Sheila, how does the program benefit NASP and its members and the specialty pharmacy industry at large? I almost see this coming full circle. You know, I'm thinking a bigger picture per se, because NASP has so many different facets and members and players kind of bolted into this. Obviously, there's a huge industry benefit. So how does the program benefit everyone involved?
Sure, Todd, really great question, right? So the program benefits NASP in that it helps to establish us again as an industry leader. We want to be at the center of everything specialty pharmacy related, and we want to be leading that charge. So we want to be working to provide the tools that all of the folks who are involved in our industry need in order to increase, patient care, right? The quality of patient care delivered and then also the outcomes of that care. Our members, I think that it's a great value of NASP membership to be able to participate in this survey, not only due to the standardization, right? That just makes it easier for everybody involved, but then also so that they can be benchmarked and so that we can share best-in-class practices. And I'm always pretty much in awe about how all of the members of our organization, while most of them are competitors with each other, they don't view their interactions that way. They're very focused on what is in the best interest of the patient and how do we elevate the practice, especially pharmacy. How do we raise that bar and continue to reinvest in our businesses and our technologies and our patient care management programs just to make sure that we're taking the best possible care of patients. So this is just another tool, in our toolbox to help do that. And I think for the specialty pharmacy industry at large, again, I think anytime that you can standardize a service and make it easier for payers and patients and pharmacies to assess their performance and to compare their performance and then to improve their service offerings, I think that you're delivering a tremendous value to the industry. Throughout my career, I've been always very, very focused on those things that we do that only serve to add inefficiency to a process that sometimes is very inefficient to begin with. So how do we start to strip away at some of those things that only add to the total cost of care without really bringing value? And I think anytime that you have a process that you can standardize and you can get a group of folks to come to the table together and to agree on this is, these are the criterion for a program that will meet all of our needs and will still to provide the benefit, right, that we're looking for in the value, I think that that's definitely a win-win. So we're very focused on utilizing all of the resources we have across our membership to help get us to that endpoint. So Tom, tell us, how does the NASP patient survey program differ from the other programs that are on the market today?
That's a great question, and just kind of piggybacking off some of the things that you were mentioning. One of the things that we took great care in developing this program is that we wanted to be something that not only benefited the members of NASP, and the participants in the survey program, but also benefited the industry as a whole. And unlike some of the other programs out there where they're pitting specialty pharmacies against each other and publishing numbers and things of that nature, we really wanted to ensure that this program allowed some anonymity for those that were participating in the program, and yet still provide some great national results. So the white paper, like we published last year, and you can find that on our website or on the NASP website, I thought brought some great insights into the program. And also we wanted to make sure that everybody that was represented by a statistically viable sample. Other programs out there, you'll see people's numbers being reported where they might have 10 or 12 responses total representing the organization. And we felt that really wasn't bringing a benefit to the specialty pharmacy industry. And finally, I think we go to great lengths to ensure that we have a tool and a resource that meets all of the certification needs and reporting needs for those that are participating in the program, whether it's to payers, manufacturers, the certification bodies. And then finally, again, like I said a little earlier, just making sure that this was something that people could put to action. That it wasn't something that just checked a box, but it really was something that when you participated in the program, results can be turned right into actionable items.
So Amanda, what has the NASP patient survey program revealed so far within the specialty pharmacy industry?
One of the, I think, big benefits that came out of the white paper that we published that Tom just referred to in the first year of the survey was the fact that the specialty pharmacy NPS score compared to a traditional pharmacy setting was significantly higher. The survey outcome for those 8 specialty pharmacies that participated in the survey for the first year, the NPS score was 78.6, I believe, compared to a 28 in a traditional pharmacy setting. So it has brought forward that overall satisfaction within specialty pharmacy is very high. It also has provided as Tom mentioned, the ability to benchmark yourself against other pharmacies with that anonymity. And I believe most of the specialty pharmacies who participated were looking to make sure that the patient was the one who benefited from this in the end. And so it has revealed that I think all the pharmacies' goal was to obviously be competitive, but be competitive in a way that raised the bar for all specialty pharmacy. And so that also raised the desire to not only evaluate the satisfaction level within the patient segment, but also the other customers that we service, and has caused us to evaluate other opportunities for us to improve satisfaction within the specialty pharmacy industry overall. And that has caused us to evaluate other potential survey programs that we can bring to bear for NASP as well.
I'd just like to add one other kind of note that I thought really stood out to me in last year's survey program was so often, you know, in working with our specialty pharmacy clients, there is this emphasis in terms of call, you know, trying to get so many calls completed per hour and really looking at efficiencies to drive more call volume through the call centers. And yet one of the things that we saw very clearly in the survey results was how important that time on the phone with those folks in the call center was to their overall satisfaction and willingness to recommend. And given how competitive the specialty pharmacy industry is, I think that really gave rise to maybe taking a pause and reevaluating some of the performance metrics that people are currently using within.
So Tom, as we look forward, let's talk about the development of additional survey programs within our partnership in this program, including the provider survey of specialty pharmacies, the manufacturer survey, the payer survey. Let's talk about that a little bit.
Great. So we have completed the provider survey of specialty pharmacy services, and that's available. It's tracking right along the same kind of proportion and lines as the patient survey. So again, it's available either online or mailed. And again, we're really striving to get that sampling so that each participant's getting a solid representative sample. And we worked with the Customer Experience Committee and other members out there to build a course that I think is very comprehensive and is going to be exciting to work with. And we also just finished the manufacturer survey. Again, I think we've got a great resource there as well with the help and resources that the NASP membership has brought to this. And then we'll be working this fall quarter to finalize the payer survey. So look to us in the next month or two to have that manufacturer survey available for people to begin participating. That one will be online only, and I believe the payer survey is probably going to track the same way as an online only survey program.
Wonderful. So Anya, we haven't heard much from you, so why don't you tell us, please, how can folks learn more about the survey program and how can they participate?
Sure thing. So we'd welcome a conversation to discuss the program in greater detail and provide some resources on how to participate. Folks can contact us via our website, SullivanLuallin Group.com/NASP, or they can give us a call at 619-283-8988. We'll also have some folks at the NASP Annual Meeting this September. Feel free to come by our booth. We'd be delighted to discuss how this might be a great resource for you as a member, and we look forward to it.
Yeah, and actually what I've noticed is if you just put in NASP patient survey in the search results on Google, the program will pop right up and it'll take you to the site so that you can get more information.
And for all of our listeners, you're in the car, you're working out, you're jogging right now, don't worry, it's going to be in the show notes. We'll make sure that we have links down there in the show notes that you can access more information. On behalf of the Pharmacy Podcast Network and the NASP Specialty Pharmacy Podcast, I want to extend a special thank you to Sheila, our host, and our guests, Tom, Amanda, and Anya, for participating in this very important episode of the NASP Specialty Pharmacy Podcast. Thank you so much for your participation, and we look forward to additional discussions to come out of the stage setter here. And once again, and to our listeners, thank you so much for listening to the NASP Specialty Pharmacy Podcast.
Thanks for listening to the NASP Podcast. Be sure to share this podcast with your fellow pharmacists, doctors, and healthcare providers dedicated to optimal patient care. If you have ideas for future episode topics, please email the Pharmacy Podcast Network. Send your message to publisher@pharmacypodcast.com.